Assalamualaikum. In this video lecture, I will deliver another chapter of the ENT series of lectures in the larynx and trachea. It's the neoplasms of the larynx, right? Neoplasms in the larynx has been really interesting to study. The very first thing comes is you study the benign tumors and the malignant tumors. Benign tumors of the larynx is a big list. Malignancies is a big list. Starting with the benign ones, the papilloma, right? Different types of papilloma, and then fibroma, chondroma, hemangioma, and all. Right. So coming up with papilloma, it's a benign neoplasm. It obviously arises from the laryngeal epithelium. It is of two different types. It can be solitary, that is single in number, or can be multiple in number, right? So सॉलिटरी पेपिलोमा मोस्टली ये एडल्ट्स में देखा जाता है, बच्चों में बड़ा रेयरली ये ट्यूमर होता है, ठीक है। ये बड़ा सॉलिटरी सा सिंगल सा ट्यूमर होता है। ये सिजाइल भी हो सकता है, लेरिंजियल एपिथेलियम के साथ बिल्कुल चिपका हुआ फिक्स ट्यूमर, या ये पेडंकुलेटेड भी हो सकता है, यानी कि इसकी एक छोटी सी स्टाक भी हो सकती है, ठीक है। वेयर एग्जैक्टली इन द लैरिंक्स डज इट अराइज फ्रॉम? द यूजुअल साइट इज द एंटीरियर कमीशन इन द लैरिंक्स and the anterior half of the vocal cord. You need to keep this exact location of the origin of the solitary papilloma of the larynx, the anterior commissure and the anterior half of the vocal cords, right? This is it. Less often it can arise from the false vocal cords, right? There are the true vocal cords and false vocal cords. The solitary papilloma loves to arise from the true vocal cords and the anterior commissure of the larynx, but less commonly from false vocal cords. By the way, it's a tumor that occurs in the adults, but don't forget it is more common in males, twice more common in males than females, right? And इसका recurrence rate ज़्यादा होता है, और इस benign tumor से malignancy develop करने का भी बड़ा chance होता है, ठीक है। और हिस्टोलॉजिकली इट इज़ स्क्वामस सेल पेपिलोमा, यानी कि इसके अंदर स्क्वामस एपिथेलियम मौजूद होती है। एक पेशेंट है जिसको सॉलिटरी पेपिलोमा है, कैसे प्रेजेंट करेगा? वोकल कॉर्ड इन्वॉल्व होते हैं इसके अंदर, खास करके ट्रू वोकल कॉर्ड्स, जिसकी वजह से आवाज़ में हॉर्सनेस होती है, ठीक है। और आप याद रखें ये दो तरह का होता है, या तो सिजाइल होगा या पेडंकुलेटेड होगा। लेकिन जो पेडंकुलेटेड वैरायटी होती है ना, so the pedunculated papilloma may be sucked down between the vocal cords during inspiration. I mean to say, if this is your larynx, and okay, this is your larynx, we can say these are the couple of vocal cords, and this is the pedunculated squamous solitary papilloma. So when you inspire, it is possible that this pedunculated papilloma may be sucked down between two vocal cords, right? Just like this. So yeah, as it is written that the pedunculated papilloma may be sucked down between two vocal cords during inspiration and then blown up again during phonation, ठीक है। So that's it. I mean to say, if there is inspiration, if you inspire the air, this papilloma, the pedunculated papilloma, gets sucked down between the two vocal cords, right? And then blown up again back जब आप बात कर रहे होते हो, एक्सपायरेशन कर रहे होते हो। तो जब ये pedunculated papilloma दो vocal cords के बीच में मौजूद होगा तो जाहिर सी बात है हॉर्सनेस होगी। और अगर ये जब वापस ऊपर चला जाएगा यहाँ पे और इन दोनों के बीच में नहीं होगा तो हॉर्सनेस नहीं होगी। तो जो हॉर्सनेस का करेक्टर है ना, चेंज इन द करेक्टर ऑफ द हॉर्सनेस डिपेंडिंग अपॉन द मूवमेंट ऑफ द पेपिलोमा। व्हेन यू इंस्पायर, द पेपिलोमा कम्स इन बिटवीन टू वोकल कॉर्ड्स एंड देयर इज ऑब्वियस हॉर्सनेस। बट if when you expire or you phonate, you speak something, this papilloma is blown upward, right? It's not between the two vocal cords anymore, and that time I don't think there will be hoarseness anymore. Okay, so yeah, let's go a little ahead now. The treatment option of the solitary papilloma. The treatment option for the solitary papilloma is the direct removal by the direct laryngoscopy, ठीक है। Yeah, under the operating microscope by surgical or laser excision. So keep it simple. डायरेक्ट लेरिंगोस्कोपी की मदद से हम इसको रिमूव करते हैं बाय सर्जिकल और द लेज़र एक्सिजन. रिकरेंस इसका बड़ा कॉमन होता है बेटा. एंड या एंड आल्सो वन वेरी इंपॉर्टेंट थिंग इज रेयरली व्हेन द पेपिलोमा इज़ वेरी लार्ज, तो फिर उसको डायरेक्ट लेरिंगोस्कोपी से रिमूव करना मुश्किल हो जाता है. फिर हम क्या करते हैं, लेरिंगो फिशर, ओपन लेरिंगो फिशर टेक्निक अप्लाई करते हैं, जिसमें आप नेक को डाइसेक्ट करते हो, फिर उससे थायराइड को रिमूव करते हो और फिर आप जाके लेरिंग्स के पास पहुंचते हो और लेरिंग्स को आप स्प्लिट करते हो, फिर जाके इस ट्यूमर को निकालते हो. दिस इज़ ऑल अबाउट बेटा सॉलिटरी पेपिलोमा. टाइम फॉर मल्टीपल पेपिलोमास, जिसको पेपिलोमेटा भी कहते हैं. सीन इन इन्फेंट्स एंड यंग चिल्ड्रन. एडल्ट्स में कॉमनली नहीं देखने को मिलेगा, एडल्ट्स में बड़ा रेयर होता है क्योंकि बच्चों में होता है, इसलिए इसको हम जुवेनाइल लेरिंजियल पेपिलोमाटोसिस भी कहते हैं. प्रेजेंट एट और सून आफ्टर द बर्थ, राइट. मोर कॉमनली अराउंड द एज ऑफ द 2 years, राइट. तो 18 महीनों में या फिर वी कैन से 22-23 महीनों में, इस तरीके से. You really don't know the etiology behind this. Why multiple papillomas in your larynx? Maybe due to the human papilloma virus, especially the type 6 and type 11. ठीक है. And what are the usual sites from where the multiple papillomas arise? The vocal cords and the ventricular bands are the usual sites. ठीक है. And in case of the solitary papilloma, it was the anterior commissure, if I'm not wrong, and the true vocal cords. Here it is the ventricular bands. But don't forget, the multiple papillomas, if they are present in the larynx, they can spread anywhere in the larynx. They can go out of the larynx into the trachea, into the bronchi, right? That's the thing, my son. Coming to the clinical presentation of the patient with the multiple papillomas, obviously it is involving the vocal cords, so there has to be harshness. ठीक है. Because there are so many papillomas, there is multiple papillomatosis. So due to these multiple papillomas, the respiratory lumen, the lumen of the larynx may be obstructed and you have dyspnea. And I think it was absent in the solitary papilloma. Yeah, it was. For examination, you perform the direct laryngoscopy. You look into the larynx and you see, oh, there are multiple papillomas which look like the bunches, right, of warts. So bunches of wart-like projections, they are pink to white in color, always multiple. They can be sessile, can be pedunculated. Talking about the treatment options, which we have to get rid of these multiple papillomas. Yeah. What we do is, beta, they are removed endoscopically by diathermization. But make sure when you are diathermizing, make sure you do not cause any सबमिकोजल स्कैरिंग, क्योंकि जब भी आप डायथर्मी करते हो तो आसपास के टिश्यू को डैमेज कर देते हो, स्कार कर देते हो. सो मल्टीपल पेपिलोमास कैन बी रिमूव्ड एंडोस्कोपिकली बाय डायथर्माइजेशन, लेकिन बी केयरफुल, हमने सबमिकोजा को डैमेज नहीं करना, क्योंकि बेटा मल्टीपल पेपिलोमास के पेशेंट को रेस्पिरेटरी ऑब्स्ट्रक्शन ज़्यादा होती है, तो डिस्निया होती है. तो ट्रेकियोस्टमी to relieve the airway obstruction should be avoided. Why? Look, usually the patient with the multiple papillomas, the patient has complained that I feel dyspnea, I cannot breathe in out properly, I am getting hypoxic. So treatment should have been the very good option. Tracheostomy should have been the very good option. You perform the tracheostomy, dyspnea is not anymore. Then why we avoid it? Because tracheostomy can cause implantation of the papillomas lower down into the respiratory tract. When you perform the tracheostomy, इसकी एक complication इस केस में क्या है कि वो multiple papillomas को नीचे dislodge करा सकती है respiratory tract में, bronchi में, trachea में, right? So endoscopically आप diathermize करके इनको ख़त्म कर सकते हैं, but now जो latest method है, advanced technique है, that is the laser surgery. Seems to be very much promising for the removal of the papillomas. And in case of laser, the submucosal scarring is minimal compared to the diathermization by endoscopy. ठीक है. And the number of other agents that can be tried to get rid of these tumors, and as you know that there is something that the role of the human papilloma virus in producing these multiple papillomas, so we can provide the vaccination, right, and vaccination against the human papilloma virus and the local application of the antiviral agents like the acyclovir, right beta. So this was the papilloma. We'll now talk about some other benign tumors like fibroma, chondroma, and other, right? We'll then shift to the malignant tumors. Fibroma. Fibroma of the larynx. What happens is, let me tell you, most of the fibromas result either from the organization of the submucosal hematoma or they are of the inflammatory origin. So they are actually not the true neoplasms. I mean to say, if let's suppose this is the larynx, this is the mucosa of the larynx, right? This is the submucosa, let's suppose. As I told you, if there is a trauma to the larynx, most of the times what happens, there is a submucosal hemorrhage and there is the formation of the hematoma, this big hematoma in the submucosa. It is considered that this submucosal hematoma gets organized and give rise to fibroma. Okay? Look, most of the tumors, most of the fibromas result either from the organization of submucosal hematoma or they are of inflammatory origin. Like if the inflammation occurs in the larynx due to whatever reason, that inflammation may complicate in a way that it can produce the fibroma. तो या तो ये hematoma से बन रहे हैं या inflammation से बन रहे हैं, but they are actually not the true neoplasms, right? Okay. Rarely in the larynx, neurofibroma can be seen. ठीक है, इन केस ऑफ जनरलाइज न्यूरोफाइब्रोमेटोसिस, जहाँ पे जगह जगह पे बॉडी में न्यूरोफाइब्रोमेटोसिस होती है, तो लैरिंक्स में भी यू विल कम टू सी. कैसे प्रेजेंट करेगा पेशेंट बेटा? क्योंकि दिस फाइब्रोमा में इन्वॉल्व द वोकल कॉर्ड्स, सो देयर में बी हार्सनेस. ठीक है, एंड द ट्रीटमेंट ऑप्शन इन केस ऑफ फाइब्रोमा इज एंडोस्कोपिक रिमूवल ऑफ दिस ट्यूमर. ठीक है, अंडर एन ऑपरेटिंग माइक्रोस्कोप. Comes after fibroma, another benign tumor beta is the chondroma. It's a rare, by the way, but arises from the cricoid cartilage, as the name mentions, as the name indicates. It is the chondroma, so it has to arise from the cartilage, and it is the cricoid cartilage. Sometimes from other cartilages. ठीक है? I mean to say, like, look, this is the larynx. ठीक है? This is the anterior side. This is the posterior side. Here, if let's suppose this is the cricoid cartilage present, and the chondroma arises from this cricoid cartilage. Sometimes what happen, and these are the, let's suppose, vocal cords, right? Sometimes what happens, this tumor encroach inside into the lumen of the larynx and can involve the vocal cords and can produce the harshness. And obviously, because this tumor is coming into the lumen, it can obstruct the lumen of the larynx and can produce dyspnea. Only option, get rid of this tumor by surgical procedure, open surgical procedure, right? Right after the chondroma comes another benign tumor, is the hemangioma. It's also not a true neoplasm. Fibroma was not a true neoplasm. Hemangioma is not a true neoplasm. Then what the heck is this hemangioma? It's simply a malformation. What happens in hemangioma? There is simply the collection of large, big, collection of the blood vessels. Right? Is it a tumor anymore? It's not a true neoplasm. It's simply the malformation of the blood vessels. So if this is the larynx and this hemangioma is present inside the larynx, it can cause harshness because of the involvement of the vocal cords, and because it is composed of the blood vessels, so some blood may leak out of this mass and can cause hemoptysis. So these two are the main presenting symptoms, the harshness and the hemoptysis. You examine the larynx, you perform the indirect laryngoscopy, or if you perform the indirect laryngoscopy, you can see this tumor in the larynx. Obviously, because it is blood filled, so it has to be purplish or bluish, right? And the best treatment for this is carbon dioxide laser therapy, right beta? And then comes another benign condition. It is particularly limited to the vocal cords, is the polyp of the vocal cord. It's not a true neoplasm. It's simply the pedunculated swelling arising from the laryngeal mucosa, especially the vocal cords. It occurs as a response of the traumatic abrasion or unresolved infection. Okay? So if these two are the vocal cords, and in the vocal cords, this is the vocal cord polyp. I am sorry if I said vocal cord nodule before. It's not a nodule. Nodule is something different. It is vocal cord polyp. Okay? Most of the times it is pedunculated like I have drawn it. So why does it appear? I mean, why in the vocal cords this polyp appear? Couple of reasons are there. Number one, due to the trauma and unresolved infection. If there is the infection, let's suppose acute laryngitis is there, and if you keep it untreated, there is a risk that it may develop into the polyp. What is the treatment to get rid of this baby polyp? Treated by the endoscopic excision अंडर द ऑपरेटिंग माइक्रोस्कोप, जो मैंने पीछे तफसील से डिस्कस कर चुका हूँ, जिसको हम माइक्रो लैरिंगोस्कोपी कहते हैं. सही बच्चों, इस तरीके से. अच्छा, इसके बाद कुछ और बिनाइन कंडीशंस हैं लैरिंग्स की, जिसमें लाइक लास्टली इट इज़ द केराटोसिस ऑफ द लैरिंग्स. Keratosis of the larynx. Yeah, what happens in this is in the larynx there is the epithelial hyperplasia. ठीक है, इट्स रेयर कंडीशन, मेल्स में कॉमनली होती है. इटियोलॉजी इतनी पता नहीं है क्यों होती है, कुछ इसके रिस्क फैक्टर मैं बताता हूँ. लेकिन what happens in this is, if this is your larynx, there is the epithelial hyperplasia, and this hyperplastic thickness appear more like a leukoplakic raised patch on the vocal cords. It mostly involves the vocal cords, right? It mostly involves the vocal cords. And what happens on the vocal cords? What is meant by keratosis? If this is the vocal cord, this is the vocal cord, you can see epithelium is very much thick, hyperplastic. And how does it appear? Superficially white, leukoplakic, raised patch की तरह दिखती है. ठीक है, या इजी. इट्स रेयर कंडीशन, मेल में कॉमनली होती है और एग्जैक्ट इटियोलॉजी पता नहीं है. मे बी ड्यू टू द वोकल अब्यूज, एक्सेसिव स्मोकिंग, अल्कोहल इंटेक, इरिटेंट फ्यूम्स, vitamin A deficiency. These are the risk factors that actually produce the risk to develop the keratosis of the larynx, right beta? Okay. Yeah, what happens beta, if there is the hyperplastic changes in the epithelium of the vocal cord, it leads to excessive cornification with extension of the papilla into the corneum. However, in this case the basement membrane remains intact. This is the histology of this disease. I want to say that in case of the keratosis of the larynx, particularly the vocal cords are affected. What happens in this condition? The surface epithelium is thick, hyperkeratotic, lots of keratin is there, epithelial hyperproliferation is there. And how does it appear? Superficially from the lumen. If you see the surface mucosa, it will be leukoplakic, like a raised patch. अंदर आप टिश्यू में देखोगे तो कैसे दिखेगा? क्या चेंजेस आएंगे? एक्सेसिव कॉर्निफिकेशन, एक्सटेंशन ऑफ द पेपिला इनटू द अंडरलाइंग स्ट्रेटम कॉर्नियम, राइट? एंड द बेसमेंट मेम्ब्रेन इज ऑल ओके, इट इज इंटैक्ट. सो आई होप इट इज क्लियर टू यू बेटा. सो इफ अ पेशेंट हैज़ केराटोसिस ऑफ द लैरिंक्स, पर्टिकुलरली द वोकल कॉर्ड्स, कैसे आएगा? खुद सोच सकते हैं बेटा. हॉर्सनेस होगी, विच इज़ ग्रेजुअल इन ऑनसेट. इट कैन बी प्रोग्रेसिव एंड परसिस्टेंट. यू परफॉर्म आइडियल एंड डायरेक्ट लैरिंगोस्कोपी. So you can see in the larynx, okay, how thick the laryngeal wall is, how hyperplastic the laryngeal wall is, how, you can look into the larynx and you see, okay, this is the wall of the larynx, and you can clearly see this is the hyperplastic leukoplakic patch, right? Obviously, but remember, in this case, mobility of the vocal cords is normal. Look, I mean to say, if this is a vocal cord, this is the vocal cord involved by the keratosis, but don't forget, their mobility is all normal, right? This is the important point in this case. Okay? And don't forget, this condition is considered as a pre-malignant lesion, and carcinoma in situ frequently supervenes in this condition. इसको प्री मेलिग्नेंट समझा जा सकता है, इससे कार्सिनोमा इन सीटू बन सकता है, फिर इन सीटू से फिर मेलिग्नेंसी बन सकती है. ठीक है, कैंसर बन सकता है. ट्रीटमेंट ऑप्शन बेटा इस केस में कि जो केराटोटिक पैचेस हैं वाइट कलर के, उनको आप स्ट्रिप कर दें. ठीक है, अंडर द ऑपरेटिंग माइक्रोस्कोप थ्रू द डायरेक्ट लैरिंगोस्कोपी, जिसको हम माइक्रो लैरिंगोस्कोपी कहते हैं, या फिर इन हाइपरप्लास्टिक पैचेस को ख़त्म करने के लिए आप कार्बन डाइऑक्साइड लेज़र भी यूज़ कर सकते हैं. इट्स ऑल अबाउट बेटा द बिनाइन ट्यूमर्स. नाउ विल डिस्कसिंग द malignant tumors. Before you see this picture, what is this? This is the vocal cord polyp. A polyp here, a vocal cord here, vocal cord here. You can see this polyp coming out of the vocal cord, right? Yeah, so this is it. We'll now be talking about the squamous cell. We'll now be talking about the malignant tumors, right? So yeah, let me tell you.